Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm perinatal mental health certified and maternal newborn nursing certified. Giving birth can be very hard on your body, so it's important that you take your time to recover. Even when you take good care of yourself, postpartum complications can happen. Today we'll be talking about everything you needed to know to identify a postpartum complication and what to do about it before it becomes a medical emergency. So click those like and subscribe buttons and stay with us. Many new moms don't know that they can get serious life-threatening complications after birth. Maternal death often happens due to lack of postpartum care. In fact, 40% of moms won't attend their postpartum appointment. So it's very important for you to understand the warning signs. There is also a large amount of racial disparity. Black women are 3 times as likely to die of postpartum complications due to lack of postpartum care. Postpartum care is usually happening at 4 to 6 weeks after you give birth. So it's important to know, again, the warning signs. If you are unsure if you are having a medical emergency, you need to call your healthcare provider or go to the ER or call 911. Really high blood pressure after birth is a sign of preeclampsia. Most women think preeclampsia only happens during pregnancy, but it can actually happen up to 6 weeks postpartum, and it can develop all of a sudden even if you did not have blood pressure issues during your pregnancy. Some of the symptoms of preeclampsia include a severe headache. This is the worst headache of your life, and it doesn't respond to the normal medications you might take or fluid intake. It also will feel like a throbbing pain. This headache may come with dizziness and often comes with visual changes. And it may just appear as pain that radiates into your right belly or shoulder. The vision changes can include flashes of light, blind spots, blurriness, and double vision. Basically anything that's not normal for you. You may also see swelling of your hands or face, which happens quickly. And you may see some severe swelling in your legs or feet. If you have any of these symptoms at all, you need to consider this a medical emergency. You need to contact your healthcare provider or go to the hospital. If you have the ability to take your blood pressure, go ahead and do so. Finally, in a lot of areas, hospital systems have come up with a warning sign. If they know that you have blood pressure issues during your pregnancy, they may give you some kind of bracelet to wear to let different hospital systems know that you had preeclampsia. After you give birth, you should continue to wear this bracelet for 6 weeks in case something happens. Infection is one of the most common complications you're going to have postpartum. This is for either a vaginal delivery or a C-section. Signs of infection can include achiness and a fever 100.4 degrees Fahrenheit or above. If you're talking about an infection of the breast like mastitis, you may see red streaks or lumps, which is oftentimes the starting sign of engorgement. Endometritis, which is an infection of the lining of the uterus, may be accompanied by severe lower abdominal pain. You might get some discharge or swelling, redness, or pain at your incision. Now this can either be your belly if you had a C-section or your perineum. Any of these signs are really telling that you have an infection and they need to be addressed right away, usually with antibiotics. If you have pain or burning when you urinate, that's a sign of a urinary tract infection. And urinary tract infections that go untreated can lead to pyelonephritis, which is an infection of your kidneys, and that's usually associated with pain and burning, plus a lower back pain that is dull. Finally, your vaginal discharge, it might have an odd odor or color. If you have this, you need to get it checked out because you might have developed an infection like bacterial vaginosis, which needs to be treated with an antibiotic. Please remember to hit the like and subscribe button so you can get our latest content. Sepsis is a life-threatening infection that travels to your bloodstream. This infection can lead to tissue damage, organ damage, and death. Some of the symptoms of sepsis are very similar to stuff like the flu. You might get chills, fever, clammy or sweaty skin, but as it progresses, things will get far worse. You may start to have confusion, memory issues, severe pain or discomfort. Your heart rate may rise, like tachycardia, or your breathing rate may rise, like tachypnea. This infection cannot be left untreated, and there are many reasons why you might develop it. So you need to call your doctor or go to the hospital if you suspect you have sepsis. Unfortunately, postpartum mood disorders are an extremely common postpartum complication. These mood disorders include depression, anxiety, PTSD, and OCD, with my personal opinion being postpartum anxiety as the most common. You may have baby blues for the first 10 days. This is a variable mood and this is considered normal. But after 10 days, any mood issues need to be addressed. Some of the symptoms might be feeling sad, hopeless, worried all the time, overwhelmed, or feeling a lack of control. You may also have some physical symptoms like stomach issues or headaches. You may find yourself having trouble sleeping or eating. Overwhelming fatigue, palpitations, crying spells are all considered warning signs for these complications. And finally, you may have some disturbing intrusive thoughts, thoughts of death, and you may find that you're very irritable or angry. If you're having any of these symptoms, you want to seek care early because there's lots of treatments that can get this taken care of quickly. For starters, you can use sleep, therapy, lots of self-care techniques, and of course there are medications that are safe for you and safe for breastfeeding. There are some other postpartum complications that you should take note of. The first one is a DVT or deep vein thrombosis. This is a blood clot that develops in one of your legs. The signs of this are usually redness, pain, or swelling, very significant swelling in one leg. It's very important for you to receive treatment of this right away because if left untreated, one of those clots can basically detach and travel into your bloodstream. This can lead to a pulmonary embolism, which is a blockage in the lungs that is caused by that clot from your leg. You might also have an amniotic embolism, which is caused by amniotic fluid or fetal cells that transfer into your blood after delivery. Some of the symptoms of these embolisms include chest pain, coughing, gasping, trouble breathing, and it's very important that you seek treatment. These are medical emergencies. Postpartum hemorrhage is another thing that might happen after your delivery. Postpartum hemorrhage is excessive bleeding. This means you're bleeding through a pad in 1 hour or less. And when I mean bleeding, it is saturated from front to back. You may also be passing blood clots that are bigger than an egg. You need to call your healthcare provider immediately or call 911. Cardiovascular diseases, heart diseases like cardiomyopathy can occur after delivery. This means that it's harder for your heart to pump blood around your body. One of the signs of this can be extreme nausea and vomiting. This can also occur for a postpartum hemorrhage. You may have some anesthesia complications that will take place in the hospital. And finally, women are at risk for a stroke after they deliver. So it's important for you to understand the signs of a stroke, including a drooping face, confusion, and trouble speaking and slurred speech. If you think something's wrong, go with your gut. Make sure you go and seek help if you suspect a postpartum complication. Postpartum complications can happen at any time, but usually they will occur within the first 6 weeks after delivery. Don't ignore overwhelming fatigue, heavy bleeding, a bad headache, a red or swollen leg, a fever, or an incision that isn't healing. And you need to call 911 if you have chest pain, trouble breathing, seizure, or thoughts of hurting yourself or the baby. I hope this video has helped you learn all about potential complications after birth and what to look for so you can seek medical care quickly. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.